Hello?
Hi, Shati, this is Gabby.
Oh, hi, Gabby. How are you doing?
I'm good. I just finished a leg fracture surgery. How are you doing?
Oh, I'm, just so stressed out. I was meditating, dealing with patients all day long. It's been just too much. What
Oh,
can I
wow,
do
good
for
for
you?
you.
Yeah, well, I'm
Yeah, so
trying.
I just wanted to see if you're available to talk about a patient.
Oh, sure. Yeah. I'm sitting on a bench down at the courtyard at the hospital. So just come on down.
Okay, sounds great. See you soon.
Okay, bye.
Okay, bye-bye. Hi, Shati. How are
Oh,
you?
hi, Gabby. I'm good. I'm
Good. You
good.
brought Jimmy with
I
you.
did. He's my therapy dog, and I take him, to my patients who have anxiety and they're like, scared of treatments.
Oh,
Yeah,
that's good.
yeah.
Yeah, so I'm glad I caught you. I wanted to talk to you about my patient. I just finished his leg fracture surgery.
Yeah.
This is a 25-year-old male who had a motorcycle accident last week.
Okay.
Just wanting to know if you had availability in your caseload for OT.
Yeah. Actually, two patients of mine got discharged today. I definitely have room for him. Send them over. I'll work on his ADLs, IADLs, performance skills, global mental functions. I'll look at the client factors, see what he needs. And of course, range of motion, look for signs of edema and infection.
Okay, sounds great. Yeah, so right now he has a walker. He can stand with standby assist.
Right.
So I thought, Shati would be the best OT to, kind of help him get back to his independence. He's very motivated, actually.
Oh, okay.
Yeah.
So yeah, him being young, he wants to get rid of that walker assistive device and get back into life and probably, sexual activity.
Oh yeah, no, definitely. Yes,
Yeah.
yes.
Okay.
Okay. Thank you so much, Shati. You're the
Oh,
best.
you're the best.
No, you're the best.
No, you're the best.
No, you're the best.
No, you're the best.
Okay,
We
we're
are
the
the
best.
best. Hello, Dr. K. We're from West Coast University, occupational therapy students in the doctorate program, and thank you so much for meeting with us today.
Sure, of course.
Dr. K, what does your scope of practice entail?
As an orthopedic surgeon, we take care of children and adults with any problems that involve the musculoskeletal system. So it can be upper extremity, lower extremity, trunk, and specifically as a pediatric orthopedic surgeon, I take care of a lot of children who have fractures. I also take care of a lot of children who have developmental disabilities, things like cerebral palsy, spina bifida, muscular dystrophy, and also children who just are born with congenital deformities.
What are the education and licensing requirements to be an orthopedic surgeon?
To become an orthopedic surgeon, the education requirements are pre-med school, which is usually 4 years of college, and then medical school, which is an additional 4 years, orthopedic residency, which is 5 to 6 years depending, and then most people now do an additional year of fellowship, though that's not required.
What is the most common diagnosis you treat?
The most common diagnosis that I treat is cerebral palsy because I have a very specific tertiary care practice. About 1 in 300 children have cerebral palsy, so there are about 1 million people in the US, about 100,000 in California, and about 17 million worldwide. And so that's what I treat mostly. So about half the children I see have cerebral palsy.
What are potential settings for orthopedic surgeons?
Orthopedic surgeons work in a lot of different settings. I, for example, spend some of my days here at Children's Hospital Los Angeles in a hospital setting. I go usually 2 half days a week to what are called medical therapy units, which are therapy units which are set up with physical and occupational therapy where I see children with special needs. And then also I spend about usually 1 or sometimes 2 half days a week in other private offices that are affiliated with here. So those would be some of the main locations where we would practice.
In what ways do orthopedic surgeons work and collaborate with occupational therapists?
Orthopedic surgeons work a lot with occupational therapists. Obviously it varies a bit in what your specialty is. So my brother-in-law, who's a hand surgeon, works on a daily basis with OTs. I work pretty much daily with OTs as well, because so many of the children I see who have special needs do need occupational therapy. A lot of it is based on what their exact needs. Some of it's a medical model where they need help with activities of daily living. Other things in the school are more an educational model where they need help with accessing the school environment, and maybe with communication devices. And also in either of the settings, they can be taught how to, for instance, drive a power wheelchair as well. So there are a lot of different ways in which I interact on a regular basis with OTs. Also, periodically, if we have children who have significant upper extremity fractures, they may need OT to work with them as far as recuperation after an injury. In addition, we see children who have brachial plexus palsies who need occupational therapy as well.
Dr. K, after you do surgery on patients who have osteogenesis imperfecta, how does the OT get involved in the post-care?
Post-care OT is really important with a lot of the things we do. So for instance, in osteogenesis imperfecta, as you know, those children have fragile bones. They break things a lot, and because their bones are fragile, it's challenging to work on, for instance, range of motion, joint mobilization when you're adjacent to soft bones. So that's, a challenge in all those children, but also in a lot of the other children I see, just teaching them how to help with self-care skills, dressing themselves, feeding themselves. We work very closely with the OTs because a lot of the children, a lot of their biggest challenges are how they can help care for themselves and how the parents can help them transition to more independence as they get older.
What advice do you have for occupational therapy students who are interested to pursue their careers in the orthopedic department?
My recommendations for OTs who want to work in orthopedics, I think, is similar to my recommendations for people in a variety of settings, and that is you need to really follow your passion. You need to find what really motivates you, what you find interesting, and pursue that. And it can be various things within orthopedics. So when I was training, I didn't really have a big passion for children with neuromuscular disorders, and it was only after I started realizing how much we could offer them, how much we could help them, that I really became so passionate about it. And I think it would be the same for anyone, especially in OT. If you're interested in orthopedics, really follow that passion and take an interest on your clinicals. Spend time with the patients, the orthopedists, the other OTs who can mentor you. And a lot of it, I think, boils down to whom you see who can be a role model for you, someone you see really impacting people favorably, and using that person to help mentor you and to help allow you to flourish in the field that you're most interested in.
Wait, I look really stupid. Oh my God, I hate this. My hands are freezing. Yes, I'm nervous. A role in planning for aftercare.
Do I have to be in the shot? I can't. I'm trying so hard not to laugh.
What is your post-care routine?
I have to go make her.
I can't. This last one is getting me.